Our fourth factor, vascular risk. This is the one you want to lower. How difficult is it? It sounds tough, but it gets back to lifestyle factors in part, doesn't it? What you eat,
Yeah.
how well you take care of yourself, manage your cholesterol, your other conditions.
Well, I think if you just look in our lifetimes as physicians, so over the last 20 years, I know when I was in training, high blood pressure was a horrible problem. And as medications not only became more available, people started to use them, then it affected not just advancement in heart disease, but also in stroke. So with better control of blood pressure, the stroke size is smaller, for example. And there's a delay in the onset of the complications of vascular disease, just like we're trying to do with delaying the age-related changes of plaques and tangles, okay? And it's just one of those things where I think with vascular changes, you need to think about not just the blood pressure, but the high cholesterol. So I think 10 years ago, it wasn't so widely done that people with even marginally elevated changes or people really attending to it. So I think that because the combination of those things can accelerate the vascular changes, that if you treat those medical conditions, I think in the next 10 years we'll see changes as well. Because again, Alzheimer's is a specific thing, but it is worse when people have those vascular conditions, whether they're treated or not, but treatment is really important.
So I think a great way to sum it up, maybe you've heard this, but a great way to sum it up is what's good for your heart's good for your brain. Okay. And so blood pressure, if you have high blood pressure, treat it. Make sure you're doing everything you can to treat it. If you have high cholesterol, treat it. Reduce your risk of heart disease, and that's going to help your brain. Eat right if you can, and what's right. There's heart healthy diets, low in saturated fat, and then there's things like the Mediterranean diet, which is getting a lot of press now and a lot of interest. What is that? That's basically low meats, high fish, high leafy vegetables, and things like that, and a little red wine. Not a lot, but maybe a glass. And so, so a diet like that is actually being shown right now. I mean, there's some studies coming out that are showing that it can actually make a difference even later in life. So I think eating right and taking care of your heart is ultimately the best way, right now, the best way to take care of your brain.